afternoon session discussing the state of mental health in the midst of the COVID-19 pandemic. With us, we have Joy Muhia. Grace Wasike will be joining us shortly. And of course, we have Emily Murkomene, if I got the name right. Emily, who just recently launched her book on the same subject. So, Joy Muhia, she's in charge of mental health at the Ministry of Health. Joy Muhia, please take it away. Give us some insight on what interventions the ministry has on this particular subject.
So just to start off, mental health is generally the state of well-being in which every individual realizes his or her own potential. They're able to cope with normal stresses, being able to work productively and fruitfully, and being able to make a contribution to one's community. That's the general definition of mental health. And I think it's important to first understand, what's mental health and what's mental illness before we go to the interventions. So some of the signs and symptoms of mental illness include a change in sleep and appetite patterns, either sleeping too much or lack of sleep, or even eating too much or lack of health. And then also changes in mood, where you can have dramatic shifts in one's emotions. One moment you're feeling very depressed and low, the other time you're feeling extremely energetic. And then also having withdrawal, whereby you have loss of interest in activities that you once enjoyed. It can also be coupled with a drop in functioning either at school, at work, or even in social activities. Another sign is problems with concentration, also heightened sensitivity to either sight, smells, sounds, and then loss of initiative or desire to participate in an activity, feeling disconnected, among others. So the common types of mental illnesses include, we have depression, which is what most people are aware of, and it's causes feelings of extreme sadness or hopelessness. And we also have bipolar, where we have episodes of either energetic or manic highs and extreme, maybe sometimes depressive lows. And then we have post-traumatic stress disorder, where it's normally triggered after someone has experienced or witnessed a traumatic event. We also have schizophrenia, whereby this one impacts, or rather, it impairs one's perception of reality and the world around them. So these are just some of the common types of mental illnesses. Now, during the COVID-19, how has it affected people with mental illness? So we've witnessed increased anxiety, and then there's also an increase of suicide cases. Many people have also lost their jobs, and this has resulted in very many challenges, which also go back to increased suicide cases. With COVID, there's the aspect of social or physical distancing, and since we are social beings, and that when you don't get that connectedness or the social interaction, it may lead to loneliness, depression, and then also emotionally, there's a lot of frustration, anxiety, hopelessness, and then I can also look at some of the things that should be done to people with mental illness in order to maintain a good mental health. So one of the key things is awareness, being able to know, what mental health is and what are the things that you can do to improve your mental health. And then social support is very, very important. And then well, we need to also acknowledge that it's understandable to feel anxious and worried, and especially when with the current changing times where there are very many uncertainties, acknowledging that it is okay for that, like it's being able to be in a point where it's okay not to be okay, and then It's also good to make time to unwind. Remind yourself that strong feelings are tolerable, and instead accept instead of suppressing emotions. And then also reducing exposure to distressing news can be quite distressing, seeing all the negative news every now and then. So it's important to, reduce that exposure just before you go to bed. And also pacing yourself between stressful activities with fun activities. After a hard task, it's good to reward yourself. Also, relaxing is very important. This you can even try having a slow steady breathing. Also having other activities like meditation, prayer, exercise, going for a walk, listening to music, reading for pleasure, just activities outside your normal everyday work. And then also having to maintain a sense of hope. You can even keep a journal, write things down. This is really helpful to, distress. And then engaging in and enjoying pleasant activities. For example, one of the very therapeutic things has been found to be sewing. That's why we even encourage, even as people age, they just engage in various activities, even gardening, cooking, playing board games, music, dancing. There are very many things we can do. And then also, one of the key ways to promote and prevent a mental health illness is practicing a healthy lifestyle, which includes good nutrition, exercise, um, even paying attention to the warning signs whereby you feel like you're about to get stressed, or you're getting to a point that is, beyond what you're used to. It's good to take care of yourself, have sufficient sleep. It's very important. Um, Eating, healthy eating, regular activities, and then trying to maintain a regular schedule. I know with COVID, most of the schedules have been disrupted, but it's really important, even whether being at home, to maintain a regular schedule. And then some of the things that currently are being done on the ground is having psychosocial support to those who are in quarantine, or even pre and post
Uh,
testing COVID.
Joy, please come again. What kind of support? Please, I didn't get that.
Psychosocial support. So this is just basically so for those just before testing and after testing, we offer psychological first aid to the people and their families, and even those who are in isolation. Despite being in isolation, it's very important to get to talk to someone. So currently, of course, due to the COVID measures, it's being done online, which is very important. And also there is a toll-free line, which is
Just let me stop you there. Joy, let me stop you shortly. There's somebody's mic on. I think it's Grace. Grace, can you please mute your mic? Grace, Grace, if you're there, can you please mute your mic? Thanks so much. Please go on, Joy.
so right now there's a toll-free line 719, which someone can call any day or time, whenever they feel a bit distressed or they're anxious. You could always call that line, and you'll be able to get free psychosocial support during this period.
It's a very, very important word you've introduced there. I'm quite new to it. Psychosocial support. Is this something that's always been there, or is it recently developed? Is it something? Is it a specific intervention specifically designed during COVID times to help people cope with the stresses and strains of this COVID period? Just give us a little bit of background on the section of the ministry that helps with psychosocial support.
So psychosocial support has been there, and it's basically offering support to people when they're going through various distressing scenarios. And in this case, we have now during the pandemic. And it's basically addressing both the psychological and social needs of an individual or their families. And most of the time, it's offered even in humanitarian settings, whereby people are either undergoing through, when there's either war. So it's a term that has been there. It is also used during the various pandemics because it can be quite distressing. It's a new, whenever we're in a pandemic, there's a lot of anxieties. People don't know what to expect. And also, this comes with, people end up dying. So there's grief. So just to support the people psychologically and socially as they go through this process.
Can you tell us a little bit about in what the process is like when somebody calls the toll-free number 719? What are the steps that they go through? Is there first a phone discussion, and then do people visit the distressed person in person, or is it completely a phone-based intervention? And then is there medication involved? Just take us through what the processes are.
So basically, when you call 719, it is a phone conversation that you'll have with a specialist who's on the other end of the line. And once, as you're going through this conversation, depending on how the clinician will be able to assess your situation, you can be referred either to a facility or to seek care. You can be directed on where to seek care. But for now, and with the toll-free line, it's basically just calling, and then you get to discuss with someone, and depending on your level, they can be able to escalate it to the next level.
That's wonderful to know. Give me an example of an intervention that is successful. Somebody calls and they're feeling distressed, and then they make a call and they have a discussion, and it goes well. Is what are the steps after? What confirms that this person is now better off? And if somebody seems to be in a situation that's escalating, what would that next level be?
Okay, so most of the times, once someone calls and maybe they are undergoing extreme stress or are feeling depressed, they'll be able to be offered therapy over through the phone, just as a start to be able, first of all, with the discussion, the clinician will be able to assess at what level you're at. And then they can be able to talk to you and try that calm you down, try to get some of the coping mechanisms that you can use at that time. And in case this is not possible at that time, they can be able to refer you to, for example, a mental health facility. Let's for this moment take Mathare because it's the National Mental Health Facility. And then once you're referred there, you can be able to get the appropriate care, but also the lines are manned by Red Cross. So you can also get follow-up, like they can be able to follow up on you the next time and find out how are you doing from the last discussion, what are the improvements, anything that has changed. And also another way of psychosocial support that was being done was during the time when people were coming in and they're put in quarantine centers, and even those who are in isolation, they get members of the psychosocial support team to come to the facility, and then they keep coming just to take you through the process, follow you up, and how are you today? How are you feeling today? What has changed? Any thing that is making you anxious? Even based on the situation, just a follow up, daily follow up, and walk you through the 14-day period as you're there because it can be quite distressing.
Fantastic. We're going to come back to that. I want to see there's some important questions. I have a question here from Marima Sianoi. Marima Sianoi, thank you for your question. She says, does this support apply to all counties? Does it trickle down to all county, right down at the grassroots level? Maybe you can answer, Marima, on that one.
Yes. So currently we have, every county has a mental health and psychosocial support team. that is what that they have all been trained. And depending on, okay, so every country has various structures, but there is a team on the mental health and psychosocial support team, and they're always alerted when there is a situation that, where they need to come in, and they follow the exact same procedures with follow-up, with referral to the right mechanism or channels.
Fantastic. Let me get Emily Murkomene into this conversation. Emily, can you introduce yourself? Tell us a bit about yourself, and of course about the book that you just launched. Before we can go back to Joy, and just after you, maybe Grace can say too. Emily, the floor is yours.
Hi,
Going well, going well.
everybody. Biran, how are you? You're fine? Yes, I'm also fine. I thank God for the fight He has taken us since we started this awareness on COVID-19. And I'm glad that we are all safe. And I urge everyone to remain safe and safe mentally, physically, and even spiritually. Yes, you asked about the book. This is the book we launched yesterday. Actually, it's the first book on coronavirus, TB, and HIV and AIDS so far known in the world. And it has got a lot of information, what we're talking about, matters of prevention, adherence, and all that, and understanding this COVID, what it's all about. So it's a book that can also be able to give you some peace of mind, because when we're talking about mental health, it means the uncertainty of the future, especially in relation to this COVID season. When COVID came, we didn't understand it at all. And everyone was just on shaky ground. We were not sure what we should do, how it will catch you, whether you'll find it when you are walking on the streets and you'll get it there. Then all of a sudden, jobs are lost. Then people are locked in the house together. So it was something that was really disturbing I can say to each person, because even we find the high and mighty could not be able to move around or travel. So wherever they were, and maybe they had strategic plans for the year, we all underwent some mental stress or mental problems. So those are the things that we bring about. We have to understand the situation. First of all, we are better informed about COVID-19, what it is. We are better informed about the transmission. We are better informed on how we can remain safe. So the issue of mental health is not as bad as it was before. But all the same, Viran, we could say that even maybe what we were expecting when COVID came, there we had been told people will be sick, people will be dying left and right. So we were not sure whether we'll be among the numbers that were being counted at that time. Many of us were not sure whether we are going to be here at this time. Then the way it has eased up, you have understood it, and we are taking precautions. Then you go back to the society, you find there are no jobs. So you still find that our mental state is still not back to normal, because we don't know what to expect tomorrow, because it's either job losses, it's either infection, children are not back to school, and all that. So it's a difficult situation, but we have to adjust and look into a brighter future. That's why we say, much as we are not having the social gatherings, people are not meeting much still, we can still not be able to go even this Christmas season. We are discouraged from partying, but we are not discouraged from meeting. Like now, I can see you very well. I can see Madam, I can see Vera there. So that kind of interaction also can be able to give us some mental peace. So let's encourage people. We encourage people to talk to one another, have these Zoom meetings. I've seen people having online parties or Zoom parties and all that. Those are the things that can be able to keep us going. Because as we face forward now, this is not Christmas season as usual. This is Christmas season unusual, because we must bear on mind that we are all at risk, and we cannot know how one is infected or the other one. So we have to be very careful even how we interact. We have also to build our inner strength, so that we don't feel like, if I'm not going to see my grandma or I'll not visit my people up country, it is not normal, I'll miss something. We have to garner our own strength and encourage even people who are far from us, so that we can be able to have those interactive sections that give us emotional, physical, and mental security.
Thank you so much, Emily. This is such an important subject that you have brought in there when it comes to people with chronic diseases, incommunicable diseases, people who are on some kind of regiment, who no longer can access easily their medicines. And that's the perfect segue to maybe Madam Grace Wasike. You can perhaps tell us what interventions have been introduced. This is a concern that I also noticed on my visit to the health promotion offices, where some of the officers also raised this issue, where they said many people who have chronic diseases and need medicine find it difficult, sometimes situations because of curfew, mostly because of loss of income, are unable to access medicine, and maybe some of them are suffering, others may be even passing away in unavoidable circumstances. Madam Grace Wasike, please, first introduce yourself, tell us about yourself, and address some of the matters that Madam Emily has raised. Madam Masike, unmute your mic. Madam Masike, unmute your mic. All right.
Are you hearing me now?
Yes,
Sorry
please.
for that. Good afternoon, everyone. Sorry for joining in late. My name is Grace Wasike. I work in the Ministry of Health in the Division of Health Promotion. I'm a health promotion expert in the ministry. So first and foremost, I would like to introduce to us what really health promotion is. In the Ministry of Health, we have several programs. And in health promotion, first and foremost, we have to look at empowering people or individuals to be able to take care of their own health and even improve their own health. And the interventions that are available include sensitizing the communities, mainly looking at the pillar of health literacy, because in health promotion, we have the enabling pillars. One is health literacy, the other one is good governance and healthy cities or healthy environment. So when we look at the pillar of health literacy, in health promotion, awareness is created to individuals and the populations to be able to take care of their own health. Meaning, for example, people should be aware that there are services that are available in the Ministry of Health, and in the Ministry of Health, you are charged with the responsibility of taking care of your health. Maybe we give information, for example, on healthy lifestyles, maybe doing exercises, nutrition, and all that pertains to healthy life. So people are empowered. So every time somebody should be aware of what they are supposed to be doing at individual level. You have a mental issue or you feel like you're stressed up, we also create awareness of where these services are available in the Ministry of Health. We have the health facilities, we have at the national and the county level, all the structures are available. So the main mandate of health promotion in regards to mental health here is to increase knowledge, create awareness, and enable people to be able to take care of their own health by individually doing what is required. After they are empowered with a lot of information, we create awareness, we sensitize, we also train so that people are aware where their services are and what they are supposed to do at individual level. For example, if we are looking at mental health per se, if somebody finds they have a psychological issue, of course, we know what health means. It's not just the mere absence of disease or infirmity. People should be healthy all round, physically, mentally, socially. So we look at that and be able to inform people. In case you find yourself not well physically or mentally, there are services that are available in the Ministry of Health. We develop messages. We are able to disseminate messages to the larger population. Thank you.
Thank you so much for that input, Madam Wasike. Would you tell me physically, if it's not by phone, if somebody wants to physically come and access some of these services, especially when it comes to issues concerning mental health, the psychosocial support, where would these offices be? Would they be in hospitals, or are they in certain specific designated places? Please help us with that.
All right. When we develop key messages that support the creation of awareness on where the health services are, we always give direction. For example, we can indicate in a poster or whatever material that we have developed that is carrying key messages that you can visit the nearest health facility, because there is where we have counselors and any specialized attention that anybody may need. We always give direction, and even giving maybe toll-free numbers, telephone numbers, email address, and physical address of where the services are available.
For example, here in Nairobi County, where would the physical offices be, or clinics for that matter, for people, in different areas of Nairobi who have mental health issues? Where can they go physically, or where can they be brought to?
All right. Thank you for that question. The structures of the Ministry of Health, of course, we have the levels of health facilities that are available, all the way from level 4, level 5, and level 6. So if you need to refer a client for any psychiatric or socio-psychological support, we refer them to the facilities that are available, let's say, within Nairobi, which are all the way from level 3, level 4, level 5 at the government facilities, where we have the experts who will attend to the clients. Depending on the client need, they can also be referred from one level to the next level for specialized management.
Yes, that's a fantastic response. So I'm just going to reiterate what you said to people watching out there. Remember that for anybody who is going through any mental anxiety or distress, the Ministry of Health has set up special designated places where you can go and get help from. Anywhere in any level 3 all the way to level 5 hospital, you should be able to get a medical officer who can assist you. And we have a toll-free number as well, 719, that you can call and be given a preliminary help and intervention. That's very important. So coming back to you, Joy, what can you add to what Madam Wasike has said and the remarks you've heard from Emily, and of course the wonderful book that she just launched?
It's amazing what all of you are doing, and I think one of the main things that I'd like to add upon is the issue of stigma, because that has been quite heightened during this period. And one of the key ways to curb stigma is how we deal with people who have a diagnosis of having COVID-19. And one aspect that will really help us to break this stigma is not attaching COVID-19 to any tribe, political grouping, age, race, or socioeconomic status, and then also acknowledging that people who have been affected by COVID-19 have not done anything wrong and they deserve our support and kindness. Referring to persons diagnosed with COVID-19 as people who are being treated for COVID-19 or people who are recovering from COVID-19, instead of calling them COVID-19 cases or COVID-19 victims, because terminology is very key. And then also being ready to welcome, persons who've recovered from COVID-19 back into the community without discrimination, because we've discovered that many people who, even after recovery, once they go back to their places, either the neighbors start discriminating them. And we're just trying to say that now they have recovered, they need to be accepted, back. And one of the key ways is also to educate people about, what COVID-19 is, how are the ways that one can protect themselves, washing hands, the basic things that everyone keeps being told, so that we can be able to dispel the myths, because it's the myths that lead to people ending up, discriminating or stigmatizing the people with COVID-19. So it's very important to break this stigma. I think you're muted, Amin.
Am I back?
Yes.
Sorry. Technology is the buttons control. Sorry. So yeah, that's a very important subject. Stigma. It's a very major concern across the board. That even prevents people to go for tests. Some people would actually want to go and get tested, and they just wouldn't go because they're afraid if they test positive, how will the neighbors treat them? how the colleagues at work treat them, and that's definitely a very deep concern. And I'm so happy that the government, Ministry of Health, are taking steps to alleviate the issue of stigma. Now, the biggest thing, like especially in our industry, in the entertainment industry, many, like the large part of the entertainment industry, have not been able to get proper work. And as it is, work is normally pretty hard to come by, and that little that was there has been hindered, and people are struggling with money. And this is like unanimously agreed upon as like the main concern when it comes to mental health. What distresses people the most is lack of money, lack of work. What distresses people, makes people most anxious? It's the same thing. Lack of money, lack of support. Is there a way that the government can help ease when it comes to the entertainment sector, particularly in terms of the earning capability, is by giving, say, venues, for example, by analyzing venues to making sure that they are compliant with the COVID health measures, so that most of us can go back to work. Is there somebody in the panel who can probably assist that? Because that will help alleviate anxiety and distress more than anything else, I would say.
Maybe I can speak a bit on that, because when you talk about the entertainment industry and people having been affected because of loss of job and having to scale down. Remember this, we say the COVID-19 occasion is something that is very new, and one way or the other, we have all been forced to adjust, to make a drastic adjustments so that we can be able to move on with life. Not normally, because it will still not go back to normal soon, but abnormally. So for the entertainment industry, maybe the things, as I said earlier, the things that we can be able to do via virtual media, that is like the Zoom meetings or Zoom entertainments and all that, you just need to identify your clients, maybe do marketing, online marketing, and say, on this day we are having a party. So you have guys maybe tuning in and celebrating and even doing the cheers online. And then if you are the DJ sitting on that panel, like no, though you are moderator here, you can ask people to pay a small fee for it. And
yeah, that's definitely something that's happening a lot, and very, very many people have benefited by moving their client.
Yeah,
yes.
That is.
Go on, Emily.
Yes, that is quite different from the normal one. But because we are saying we are living in abnormal times, we have to take abnormal measures so that we can be able to survive. Remember, most people have scaled down. Most people, their salaries have been slashed. Those who are lucky. There are others who have completely lost their means of income. But
Yes.
one way or the other, they have not given up. They have to move on with life. So come up with vision. Secretaries even come up with all that. You can be able to within fill in the required at the moment. And let's talk about medication. The chronic disease, we have top therapy, whereby a healthcare worker engage with a patient to ensure that each patient has been reminded when to take their medicine, even the time to take their medicine. Because we know most of the patients, the ones with the chronic illnesses like cancer or tuberculosis and all that, there was that phobia that if I walk out, I'll get infected, which is true because they have other conditions. They are more vulnerable in case they get infected. So it's encouraging them. That's what we've been doing, encouraging them to stay safe first of all. Maybe just to move out when you have to go and pick your medication, and when you have to go for your daily hustle, you make sure that you are fully protected. You have carried your sanitizer, or you are washing your hands, avoiding touching services anyhowly, because we never know which service is contaminated. Make sure that you have your mask and handling your mask properly, not just touching your mask anyhowly, and you keep on transferring the same germs to yourself. And when we talk about the issue of stigma, and I keep on telling people, even yesterday when we were launching the book, I was telling them, let's treat everybody as if we are all COVID-19 infected. So you bear on mind, you are the only one who is not infected with COVID-19. Then that way, you don't have to discriminate on anybody. All you have to do is to make sure that you protect yourself, you keep yourself safe. When you get to your house, you do the things that you're supposed to do. So you will not discriminate on anybody. Remember, COVID is not something that walk on the streets and is written on your face you are suffering from COVID-19. The people we know who have suffered from COVID-19 are the ones who are in the isolation wards or on quarantine. And isolation wards are the ones we know they have suffered from COVID-19. The ones who are under quarantine are the ones who have come in contact or been exposed to somebody who has tested positive. But now, because we already started the community transmission, how do we know how many of us have not been affected? Me, I tell people that maybe I'm a COVID survivor 101 times, because maybe I've already got it, people are getting it and getting well. I would have gotten it, maybe.
Sorry, let me interject. Are you saying that you probably have had COVID and didn't know, or you've probably had COVID and you didn't get tested, or like, I'm trying to understand that last bit that you said.
What I'm trying to say, you see, the symptoms of COVID are just like for the normal flu, where you feel maybe the chest pain, or maybe the running nose, maybe you are coughing and all that, maybe fever, which is also associated with malaria and other illnesses. So if you develop fever today and you take your paracetamol and you get well and you have not gone for testing, you will not know whether that fever was a cause of fatigue or any other illness if it disappears within a given time. Or if you start maybe coughing and all that and even feeling weak, and then you say, maybe I didn't sleep properly, let me rest. You go on self-quarantine for a few days, the way you normally fall sick, and then you get to your feet. So other people who are very strong, you still have that severe headache, maybe not develop high fevers. You go out there, you work, you are feeling sick, you are actually even feeling the congestion of the mucus on your throat and all that. But to move on, and maybe after 2 or 3 days to realize that thing has disappeared, maybe you have taken some paracetamol, but maybe you have not had the time, or you have not thought or been in that severe condition, and because you don't know that you have been exposed to a COVID-19 patient, you don't go for testing. So you cannot really tell how many of us are COVID-19 survivors and we are working, because our immune system is strong and we keep on taking the necessary measures to ensure that it does not pull us down. So let's not discriminate on anybody. Let's not discriminate on those who have been hospitalized and come out, because we might also be COVID-19 survivors.
That's very, very important. This one goes out from it's a comment. We did start a bit late, so I'm going to ask my director Rachel Wainaina to allow us to just go maybe five minutes past 3. We were supposed to stop at 3 p.m., but we started late due to a technical hitch. So I'm going to request Madam Wainaina to just allow us to go 5 or 10 minutes more. We have a question, or we have a comment from Solomon Kane, who says this forum is great and it's just perfectly in order that this is happening now. The COVID pandemic has come with its challenges and fair goods. It's just perfect time to take health promotion to the next level from here to even the Kenyans who can't afford internet connection and a smartphone. So one thing I can assure Mr. Solomon is that the Health Promotion Division is working super hard to get the message across to all parts of the country. And thank you for reminding us and to do this job. And we will continue to strive to be able to get to more and more people. Remember that this session is recorded, and you'll still be able to see it on the health promotion social media sites, on YouTube, on Facebook, even after it's done. So, and after that, we're gonna address the issue further and make sure that you are in our inbox, and we let you know how we can get to you. And that's a very important comment, Mr. Solomon Kane. Another comment, I'm also a member of the Creative Society of Kenya, and many of the creative sector leaders have been saying that many entertainment venues, I'll come back to that again, need to be, how can I call it? Need to be ratified and be given a chance to work under COVID rules. So I think not everybody has been licensed yet. Not everybody has been inspected. I think maybe the Ministry of Health can expedite inspection of entertainment sites so that as many as possible can get back to work. Madam Emily, please tell us where we can get your book, because I myself would like to access it and read it, and I'm sure the public out there also would like to access this book. Where can we find it, and how do we go about that? Madam Emily, your mic. Oh, good, perfect.
For now, we are negotiating with the Savanis bookshop to see if they can be able to stock the book for us. Remember, we just launched it yesterday. So we are just going to start the process of distributing to the outlets like Textbook Center or Savanis bookshop. And at the moment, you can still be able to get it from me if you are based within Nairobi. And like today, I had a consignment sent all the way to Mombasa. So you can be able to order and we can put in the bus and it can come to you. I think I gave my number yesterday when we were doing the launch, 0721 837 019. 0721 837 019. It's an awesome book with nutrition, hygiene, physical exercise, not just about COVID-19, but beyond COVID-19. Remember, these other diseases are here with us. They remain here with us.
Madam Emily,
going to overcome COVID-19.
Madam Emily, your audio is breaking. Your audio is breaking. So if you can send that information in chat form, we'll be able to put it on our social media platforms, and that will be fantastic. I think
I'll do that.
Yes, I think it's almost time for us to leave. Madam Wainaina, Rachel, if you're around, you can come in. Our director can come in and say a few words and give us an idea of what's remaining on today's program, and also tell us about what's coming tomorrow. Madam Wainaina, can you come in? Okay. Madam Rachel Wainaina is still sorting out some other matters. We can perhaps talk about some other situations around mental health. Maybe Joy, if you have access to some of this information, you can let us know what is the most prevalent case, what type of issue is most common, and we can give our views on that. Joy, take it away. The floor is yours.
During this period, some of the most okay.
Hello.
Yeah.
Sorry, Madam Rachel. Yes, we can hear you. It was just we were just as you came back, we were just discussing, and I asked Madam Joy what kind of mental situations or problems are most common, and she was just giving us some insight on that. Joy, take it away, and then Rachel, you can come in and give us your closing remarks.
So during this period, some of the major cases reported are mostly to do with anxieties due to the uncertainties of this period. Very many people have a lot of anxieties. There's depression, which has also skyrocketed during this period. Losing employment, and then people, especially during the lockdown, people were staying either at home with no social bubble, or how people are social beings. And that really took a toll on many people. And then also there's been an increased number of suicide rates. And this is also as a result of even the depression, where people end up feeling like there's no hope for living, so they end up dying by suicide. So those are three major cases that are mostly reported, and as well as those who had pre-existing mental health conditions. There's been a high rate of relapse of the same from those who had already pre-existing conditions.
Fantastic, and that gives us at least a very good guideline as to what's most commonly affecting our country when it comes to the mental health situation in the midst of this COVID-19 pandemic. Madam Rachel, please come in. Tell us what else is in store for us in today's program. Tell us what's happening tomorrow, and maybe some closing remarks. Rachel Wainaina, please. The floor is yours.
Thank you. Thank you very much, Virani. Just to begin with a very big vote of thanks to this panel. Before we started, I said it, this was going to be a great discussion. And true to that fact, the panelists, you've not let me down. The moderator was amazing. Virani, thank you so much. This is indeed something we need to talk about and something we must talk about. We've all seen how many lives we've lost of young people due to mental health challenges. And I'm positive that if we keep on embracing and understanding that mental health is not something abnormal, it's an issue that can happen to anyone, and stop stigmatizing it, then we are going to move forward and become a better and healthy nation. Also, I've had so many issues coming up, the issues of compassion, the issues of trying to find alternative solutions to problems. And also, I've understood deeply about mental health. Thank you, Joy. Thank you, Emily. Thank you, Madam Grace Wasike. I've also understood so much about health promotion and the important job that health promotion is doing. And this division, I was surprised when I came to meet the Division of Health Promotion officials and got to see the amazing work that they're doing. And then just realized that, they needed our support as Kenyans. Remember, our health is our responsibility. We can't say it's the responsibility of government. So basically, this panel discussion was much needed. Very good questions, Virani. Very good questions. And I believe if you've been watching this, you've learned a lot about how to take care of yourself. So thank you very much to our panelists. Maximum respect to you. You're part of history. Of course, I'm repeating the whole day saying this is the inaugural, the first ever health promotion festival, audiovisual festival, not film festival, but audiovisual festival. It has covered 18 categories of creatives who have been making a huge impact in this country with their messaging. And just to see this synergy between the Ministry of Health and the creative industry is an amazing, amazing thing. I never thought it would happen in my lifetime. But here we are, and I'm super proud to see all these stakeholders coming in place with the organizing committee. Virani, your organizing secretary, Dr. Zipi Okoth is also part of it, and you'll be meeting more of them. Emily is part of our steering committee together with Madam Grace Wasike. Enjoy. Thank you very much for joining into this, and we are hoping to pull you into this task force so that you can guide us better on how to do more of the mental health challenges. And so today the program for the panel discussion is over. After this, at 4 p.m. to 5 p.m., we have a lot of good stuff lined up for you. Go to our Facebook page, go to our YouTube channel. We are streaming live all the selected productions. And don't just go to watch, go watch, learn, give us your comment, give us your feedback. That will really help us improve moving forward. And also the filmmakers really do appreciate your love and support. And to all the filmmakers out there submitted in this festival, even if your work was not selected, actually we picked some work that was not selected, and we are also showing it in this festival because you're our heroes for taking responsibility to make good content that inspires and that actually makes people change their lives and live a healthy life. So basically tomorrow we are back here at 9 a.m. Starting again, we're going to have some screenings and 2 more great panel discussions, which we expect to also publicize on our social media pages so you can know the panelists and the moderators. For now, maybe I would say thank you very much so that you can be able to take a water break, tea break, take a walk, and come back at 4. Join us on our Facebook page, Division of Health Promotion, MOH, YouTube channel, Division of Health Promotion, MOH. Also follow us on Twitter, MOHDHP, and the same for Instagram for more information. And let's keep in touch. Let's keep the conversation going. We are so proud, and this is teamwork and a collective effort of very many responsible Kenyans. So to all those Kenyans, we say asante sana. Thank you very much for this day. We are so proud that this day happened. Thank you very much and have a good day.
Thank you
Thank
so much.
Good
you.
Thank
evening.
you.
All right.
Bye.
Cheers.
Bye.
Bye, everybody.
Bye.
Bye.
Bye, Madam Grace. Bye, bye.